This is episode 82 of Stand Up. My name is Pete Dominic. It is Monday, April 13th, 2020, right in the middle of the pandemic. I've got an awesome lineup of guests joining us today. Dr. Prakash Gatta, fresh off of his appearance on the Rachel Maddow program, the most respected bioethicist in the country, according to me, Dr. Arthur Caplan of NYU, and a little chat to kick it off with my dad. But before we get to that, I've got some very interesting audio clips to play for you. Shall we do it? Let's do it. Hi, everybody, and welcome to Stand Up, where every episode, and it's now daily, because why not, we talk to the best experts I can find, the most interesting folks, and my dad as well. What category would we put him in every Monday? A little chat with my 75-year-old father, and that'll happen today. Over the weekend, and I hope you had a good one if you're listening on Monday. People don't necessarily listen to podcasts on the day they're posted. I understand that. But I hope you found things to do with yourself, with your family, with your life over the weekend. I got a lot done around the house. But I was listening to my friend Dan Harris's podcast. Dan is an ABC News anchor. He has an awesome podcast. He wrote the book 10% Happier. And a lot of his podcast is about, and the podcast, by the way, is called 10% Happier. A lot of his podcast is about meditation. He had an anxiety attack on the air, and you can go watch it, where he just froze up. He went on this long journey, discovered meditation, and he's really not a, kind of a spiritual Eastern philosophy, woo-woo, foo-foo kind of guy. He's science-based like myself. This is part of his appeal to me. Anyway, I'm listening to his episode 237, 10% Happier with Dan Harris. And it asks the question, is it still okay to be happy during all of this? And I think that's just a fascinating question to ask and try to answer. And his guest for the whole episode is a woman named Sylvia Boorstein. And I'd never heard of her, but she's an author, a psychotherapist, and a Buddhist teacher, and as Dan calls her, one of the OG original American, experts on mindfulness. And I listened to this podcast twice, Saturday and then again Sunday, and I grabbed a couple of clips from it that I wanted to share with you, because what Sylvia Boorstein says on this podcast is so profoundly impactful to me that I just had to share it with you. So I wanted to kick it off by today's episode by just sharing her words from Dan's podcast, and hopefully they resonate with you as much as they did with me. I have 3 clips here, but the first one here, she talks about how she reevaluated the way that she thought about her life, and seeking wisdom was always something that she had done. It's always something that I am doing, that you're doing. That's why you're listening to this show. You're just trying to learn, and you're curious, and you're passionate, and you want to learn more about all of the most important issues of our time, especially now during this crazy time. And so Sylvia Boorstein says it became less about seeking wisdom and more kind of about being kind. And that is the key to happiness and away from suffering. And I can't really say it very well, so let me just let Sylvia Boorstein say it right here from Dan Harris's podcast, 10% Happier.
So the attached thing over all these years has been to think, as wisdom accrues, then we are more compassionate, because we more and more realize that the same causes of our suffering are the causes of suffering for other people. And we become more attuned to other people's suffering and more oriented to other people's suffering. And what I'm thinking is, I'm not sure about that, more attuned to, but we are now so oriented to other people's suffering because we can't not be. The news around us all the time is showing us people all over the world suffering all kinds of people near and far, and then we hear about from our friends and our relatives. And I'm thinking that it was more hypothetical to me before that kindness would happen, or that we should, where the emphasis should be is on developing wisdom so that we've had kindness. We would have kindness as more and more of a response. And before I said to you that my goal in my practice is to have a sweeter and sweeter mind, not because I want an award for the most sweet mind, but because I would be a happier and happier person. But I actually wrote a book about that. But now, with some chagrin, I think now I actually get it. Ex post facto, even ex post facto to writing the book. I'm not at all sure that we need wisdom. I think that people who are naturally kind, who live their whole life attuned to the needs of others and responding to them, are happier people.
Just being kind is enough. I'm not at all sure that accruing wisdom is what alleviates suffering and helps find happiness. It's being kind. I couldn't stop thinking about that. Is that as profound to you as it seems to be to me? How do you alleviate suffering? How do you deal with anxiety, with stress, especially during this time? Well, you pay attention to other people. You listen to other people and other living things, whether it be your cat, your dog, your bird, your horse, insects. She says in this next clip something that is so profound and yet so simple in a way. I couldn't stop listening to it. I hope that you'll hear this and it resonates with you the way it does with me. I played it over and over again.
I'm thinking of primary importance is the idea of teaching that paying attention to other people and their needs is an immediate solution to being pulled under by your own preoccupations and your own needs. That the person next to me is my surest salvation. If I turn to somebody and say, how are you and how are you doing these days? And they say, well, I'm so glad you asked. I'm terrified and I have my children at home and my husband's job is imperiled. They feel better because you asked, but you feel better because you asked. And for a moment, you are not preoccupied with your stuff and your own mortality or your own vulnerability. And I think that is the biggest secret of all, that kindness is actually the salvation, the source of happiness, that we are so preoccupied with our own self, and maybe not for all time, but certainly recently. How do I feel and what's my emotion? And I really think, I just said it, so I don't need to say it again, but my salvation is being interested in other people, being interested in other living things, reaching out to them.
I remember where I was when I heard that. Reaching out to them, reaching out to other people is of primary importance to her. That's what I've been doing. That's what this whole show is. That's what I'm trying to do each and every day, reaching out to people. I've been calling people randomly, old friends, new friends, listeners and subscribers, and it's bringing me happiness. It's alleviating my stress, my suffering, my anxiety, and not only people, but she goes on to list an example of, there's some study that when people take care of plants, it makes them happier because they have something to take care of. I just love it. I love this woman, Sylvia Boorstein. I'm so happy that I discovered her on Dan's podcast. And then here is one more clip from Sylvia on Dan's podcast where, well, here it is.
Sometimes if I'm giving a whole Dharma talk, I might read the poem by Rumi of The Guest House. But it's been read so many times on retreats that all I have to say is think about the poem by Rumi called The Guest House and not read it. For those people who are listening who don't know, first of all, you can Google it online, but think of this life as a guest house. Every morning you open the door and there's a grief, there's a worry, there's a problem to be solved, there's a this. Welcome them all in. and you'll learn from all of them. It's a lovely poem. That's why they read it all the time at retreats.
She didn't read the poem. She was just paraphrasing it. I will read it to you at the end of today's podcast. But I hope that you liked those clips, and I hope that you listen to Dan's podcast, 10% Happier, and subscribe to it, because it's really good. I've always been interested in Buddhism and Eastern philosophy, but I think I'm going to go revisit all of those books that I have on my bookshelf and try to relearn all of those things. You know, it gets all repackaged for the Western audience and society so that we can digest it and understand it without some of the more difficult concepts to understand and apply them to the way that we're living our lives now. And now is more relevant than any other time. So I just thought those were great. Is it okay to be happy right now? Yeah, it's okay to be happy. That's what you need right now, because there's so much anxiety and fear and stress. All right. Well, this conversation with my dad made me happy. I love that I still have my dad around, and that he's as funny and smart and inquisitive and judgmental as he has always been. And I love our chats. And why should those be had privately? I want to share my conversations with my dad every Monday with you. Then coming up, Dr. Arthur Caplan and Dr. Prakash Gatta, my experts for today's episode. Here's my latest conversation with my old man right now. Chuck down. Chisel D! Joining me now, as he does on the Monday episode of Stand Up, is my dad, who's up in upstate New York. Hey, Dad.
Hey, Syracuse, New York. Hey, Pete, how you doing, man?
Okay, we got a few things to discuss on today's episode. Let's start with the fact that you ordered a product from China. You got some new wheels for your car.
Yeah, I got some new wheels, yeah.
And
they came from the Wuhan, and I know they came from Wuhan.
Are you joking? Were you joking when you accidentally said Wafu, or did you really think?
It was Wuhan, right? Your mom just told me.
But you said Wafu.
Well, I know it was Wa something, okay? So I said Wa, and then Fu came. It's Wuhan, okay. They came from Wuhan, and I had 4 boxes, and they're huge, big wheels.
Yeah.
And so I sprayed the boxes down, and then I took the wheels out.
You sprayed all 8 sides of the boxes?
Well, there's not 8 sides to a box, Pete. Box has 6 sides.
6 sides?
Yeah, all 6 sides, yeah.
I'll edit that out.
Yeah, no, don't edit it out. If you don't know how many sides are to a box, I mean, just don't make me look the only one that looks stupid here. You call a box 8-sided. I don't know you'd have an 8-sided box.
Wafu. So that's what we're going to say now when one of us says something stupid.
Yeah, well,
that's a real Wafu.
Don't start editing everything out, because if we edit everything out that's stupid, there's not going to be much of it.
Well, I won't edit any of the stupid things that you say out.
No, well, you can't edit. No, it goes both ways.
So you sprayed the boxes down.
I sprayed the boxes down. I had to go to UPS to pick them up, and they weren't going to give them to me because they were addressed to a shop that was closed. So the shop, they couldn't leave them there. So I went to UPS, and they said, well, I said, they're my wheels. They says, well, yeah, but we can't give them to you. And then they looked on the label, and it says, well, it has your name on here. I says, yeah, that's why I think that you should know they're my wheels. So anyways, I finally got them. It was quite a battle. So I brought them home, and I sprayed the boxes, sprayed the inside of the car. I had to use your mom's car. And then I went out and took them. I opened the boxes, and they were wrapped in plastic. So I took the plastic off. Then they had a cover on them. I took the cover off, and I sprayed the wheels all around, and I put them back in the box.
Don't you think that if there was any virus on it, it would have died because it took so long to get there from China? I mean, why are you more worried about things that come more locally?
You have to understand something, Pete. I got a lot of spare time right now.
And a lot of Lysol. How many cans of Lysol did you go through?
I went through a lot of Lysol. It didn't seem like a big deal at the time. Yeah. And Lysol kills virus and bacteria 99.9%. Everybody should know that.
Oh, all right. Well, whatever the label says. So,
it did that on the label, yeah.
All right. So you also wanted to talk a little bit about the President Trump's week. He's been lashing out at media outlets as usual.
Yeah. You know, I guess he's mad at I hear he's mad at Fox. I guess Chris Wallace. I actually I like to listen to Chris Wallace because I think he still makes sense. He's not afraid to kind of take a what used to be the old style Republican approach, and then he lashed out at the most conservative newspaper, and in my opinion, the most honest newspaper in the world, the Wall Street Journal, because all they care about is making money. They hold no bones about.
Why would that make them honest? If all somebody cared about was making.
You got to understand something. If they report something, they're so conservative, financial conservative, okay, that if one company takes over another company, and the first thing they do is eliminate 50,000 jobs, the Wall Street Journal will report that as a good thing because they're going to make more money. If you have stock, you're going to make more money now on that. I mean, they're horrible. Don't misunderstand me.
They're morally reprehensible, but you're saying they're honest.
Morally? Oh, no morals at all. But they report straight.
Well, their editorial page is filled with conspiracy theories. So,
well, there you go. Maybe the president's right. Maybe he should be pissed at him.
So, well, he's the leading conspiracy theorist. But yeah, so he's been going after Fox News. He went after their weekend coverage, and now the Wall Street Journal. So, what do you attribute that to?
I think he's got Reagan disease.
What's that?
Well,
dementia, like.
Yeah, exactly.
Well, why do you think?
Well, listen to the guy. He only knows 9 words. If you listen to him, I mean, he says, "I know lots of words." Well, say some of them without repeating them 6 times. He repeats himself all the time when he talks, and as soon as he's done with the notes they gave him and he goes off track, he just destroys himself. He sounds like a complete idiot. And I think he's got Reagan disease. Reagan didn't know what was going on the last couple of years he was president. He was totally lost. He was clueless, and I think this guy is losing it. And if he were to get reelected, it could be absolutely. It's scary now, but he's bonkers. This guy is cuckoo for coconuts or something. I mean, he has no idea where he's at anymore.
He said when he was asked, is he going to reopen? How will he know when to reopen the economy? And he said, I don't know. I'll check with myself. Like
yeah.
You see that one? He just pointed at his brain.
No, he's gone.
And I know you also wanted to. You were paying close attention to what happened there with the Secretary of the Navy, who fired the commander of an aircraft carrier because the commander warned that they weren't doing enough to fight the virus, and and so he was fired for writing a letter. And then the Secretary of the Navy was fired for calling that guy an idiot, apparently, or for speaking out about that guy. And what are your thoughts on that?
Well, I'm trying to. I don't know who fired the Secretary of the Navy. Was that? I'm confused if that was Trump or if it was.
I don't know. I think generally what happens is when you're getting bad attention, and this is not only Trump, this is a lot of politicians, and you're getting a lot of criticism, and you're being asked about it all the time. It's just like cut our losses, get rid of that guy. I mean, that happens, and I would imagine that's what happened. I don't know though. I
think when I guess he's probably the 7th or 8th choice to be Secretary of the Navy, maybe 10th.
Well,
he's pretty far down the chain. So I guess firing him, I mean, nobody knows who he is. I don't even know.
Well, the only reason he was there in that job is because the last Secretary of the Navy was fired after he bravely and correctly spoke out against the White House, Trump's interference with the Navy's decision on how they were going to court-martial a murderer.
Yeah.
Of course, this guy Gallagher, this Navy SEAL, Trump promoted him and pardoned him, and that guy's now making money selling T-shirts and doing interviews, and he's a hero. That's why this guy was the Secretary of Navy. And so now, Dad, I don't know if you know this, but now the new Secretary of the Navy is the Riddler from the Batman series.
I was wondering what he was doing lately. I didn't know if he was out of work or what.
Yeah.
That's terrific. He's back in the headlines.
Yeah,
That's
riddle
wonderful.
me this.
No, I did not know.
Yeah.
But like I said, the guy, the Secretary of the Navy who just got canned, we don't know how far down the line he is. But he wasn't the first choice.
No,
obviously.
I just don't. His last job was he managed a McDonald's in Phoenix.
Okay. There you go.
And
so he was down the line quite a ways before they chose him.
Yeah.
And now we've got the Riddler, who may be the 25th or 30th choice for this job.
But he'll do a good job.
That's how bad the administration is getting. That's my point. It's just it's off the wheels.
Well, what did you think? I got to ask you this before we wrap it up. What did you think of this?
We're going to wrap it up?
I know you got nothing else to do, but I got to do stuff. So
okay, what?
No, I just want to ask you about, Easter. How was did you guys go to church?
What else are you going to ask me?
I know you don't go to church, but
we don't go to the end of the street. We don't go anyplace. Nobody went to church today, Pete. Except for Kentucky.
Did you watch church on TV? Did you watch the?
Well, of course we did. But nobody went to church today.
What do you think of the idea that Christ was crucified on a Friday and he walked out on a Sunday? The cave there or whatever.
What do I think of it?
Think of that story.
I actually believe in Jesus Christ, and I believe in his teachings, and I believe that if you followed Jesus, we'd all be better off, okay? Where he got up and walked out, I'm a little bit leery of that deal. And then but here's what we've done. We've taken a story that is one of the most it's from the Bible, bestseller, and it's one of the greatest stories in the Bible. And then we've got a bunny rabbit hiding eggs.
Yeah.
And I cannot for the life of me make that quantum leap connection between somebody who gave his life for humanity and a bunny rabbit and eggs, boiled eggs, no less. I just, I don't know what that is. Don't know.
You've never bothered to look up the origin of the Easter Bunny?
I didn't know you could look it up.
Spring symbolizes new life and rebirth. Eggs are an ancient symbol of fertility. According to History.com, Easter eggs represent Jesus' resurrection.
How?
I didn't read that far.
Oh, okay. Yeah, I could see where you wouldn't.
All right, I will talk to you tomorrow, and I appreciate you joining me today on the show,
okay.
Pop.
All right. Thanks, Pete. Love you. Take care of yourself.
Love you, too.
Make sure you stay healthy.
You, too, more importantly. Make sure you scrub all your boxes.
I got soap and water.
That's good.
160 proof alcohol. Did you know that's what goes into hand cleaners?
No.
Did you know that?
No. That's what, but I know that there's a lot of alcohol because sometimes people are really hard up. They'll drink it.
Something. When they talk what goes into hand cleaner and how it's going to kill things, it starts out with 60% by volume 60%, but it's 160 proof alcohol. It's like wood grain alcohol.
Yeah.
Raw alcohol.
Yeah, that's why some people drink it if they're really desperate, like prison.
It's the other stuff that's in it that would make it taste really bad for you.
Yeah, I bet it's pretty bad.
I was talking to a friend of mine who owns a distillery, and he switched over to, John. John owns a distillery now, and he switched over from making gin and vodka to making this hand cleaner, and
really,
it's that's what he used. Because I asked myself, he says we did 400 cases, and we're waiting for more 160 proof alcohol to come in. But that's what's in it. So does it kill the virus? Yeah, it's 160 proof alcohol. It'll kill the virus.
There you go. Advice from my dad.
Okay, man.
All right, Pop.
Take care.
All right, that is my dad. I have no plugs for him. He's retired. He's not on social media. He doesn't care. But I always love talking to him and sharing those conversations with you. All right, our first doctor joining us today is Dr. Arthur Caplan. He is a bioethicist at NYU. He is on Twitter at Arthur Caplan. And we talked about the president's irresponsible suggestions about this stupid drug that he wants everybody to take. We talked about the idea of rationing ventilators, and if we've gotten there yet. We talked a little bit of politics, Dr. Arthur Caplan and I, about the leadership from the president versus governors, etc., and more. All of that right now with Dr. Arthur Caplan. Back with me, of course, the great Dr. Arthur Caplan, who a whole bunch of journalists, smart journalists, are turning to the way they always have, I should say, but I've been turning to him weekly, if not more often during this time. Dr. Caplan, thank you as always for joining me.
Hey, Pete.
Lots to talk about with you this week, and I think that the big story that we need to discuss and try to unpack is the fact that the president, many of his supporters in the media and around the country are constantly talking about a drug that they think should work. It's a miracle drug. There's so much to discuss about this in terms of bioethics, in terms of morality, and in terms of science. Where do we start with the promotion of this? What is it called? Hydrochloroquine, chlorine?
Quinine, yeah. And they usually are talking about it packaged with a kind of Z-Pack type thing, an antibacteria thing. So I haven't seen this much testimonial and testifying since Jim Bakker was on the air with his Tammy wife years ago. I mean, these are like, they become rituals of a sort. You know, I heard this, I have a testimonial, I'm going to witness that this was given to my son and he got better. Medicine never works that way when it's done right. You don't go by testimonials. Testimonials and case reports are interesting, and then you want to investigate. Trump said, I love this drug because there was a French study that showed that it cured everybody, and I love this drug because it's already approved. Right, the malaria drug. You could get it. So his attitude was, why not try it? Although there are many things that are already approved. You could argue that you should drink apple juice or take ibuprofen, or there's a zillion things you could be saying. Well, they're approved, so why not try it? So I looked into this French study. It is already retracted. It's bogus. The journal hold it. It had 26 people in it. The guy who did the study in France just lied and didn't report on 6 people who got the stuff and didn't get better. It didn't get better. So it's already pulled. It's what we call a retraction. Journal took it away, and that was the thing that set off all this, I don't know, testifying.
How often does that kind of a thing happen? A study gets put out and then gets retracted or pulled? Because the point is, as we all now know, over this situation with autism and that Lancet study, once the horse is out of the barn, the toothpaste is out of the tube, you can't put it back in. Once people have reported on it, once it's out there, especially when it's a situation like this where people are desperate for a solution, they hear that there's a, quote, study, and then they run with it. How often does this kind of thing happen?
I'd say maybe 1 out of 25,000 papers, 1 out of 50,000. But it doesn't happen.
Not often.
Not often. Now, maybe there's a few that slipped through that should have been retracted that we didn't catch. But no, it's really, really rare. This one got immediate attention, though, because it has set off such a cascade tsunami of, let's all take this drug. So let me explain something else.
Yeah.
The drug is approved. It's approved for malaria. The persons who probably used it and it was approved for are people who went on safari to Africa, probably age, let's say generously, 30 to 50, the kind of tourists that might have been off to a malaria area from, the U.S. or North America or Europe or something. That doesn't mean it's a drug that's safe to give to a 75-year-old in lung failure with 3 other diseases. It's like, it doesn't extend that way. Do you remember a drug called Vioxx?
Yeah, that was the one. I think we used it as an example a lot for, a pharmaceutical company knowing that a drug was maybe killing people, and there's a massive lawsuit, right?
Right. So Vioxx was approved. It went all the way through FDA. It got approved. It wasn't until they started giving it to older people that they started dropping dead of heart attacks. My point.
The point is, drugs are approved for certain situations, certain ailments, diseases, and illnesses that certain people and demographics have. And even an amateur doctor would be able to know that. Oh, yeah, no, you can't. That drug is not going to be good for you because you're an older person, or you're even, a man, or there's all kinds of.
Or you're on a ventilator.
In this case.
Maybe you're not going to dump this drug into you. One other thing to keep in mind. By the way, I'm not saying you shouldn't study this drug. Fine, people want to put it in a trial. And some listeners will think, well, put in a trial. It's going to take a year. We can study this thing and get an answer, relatively speaking, in 6 weeks about whether it's doing anything. You start to see some biological activity, you can measure it. So the notion that we should all run out and take it either galactically, I think a couple of people already did because they saw it was an ingredient in their fish tank cleaner and swallowed it. But it is easy enough to get an answer that would be, kind of confirmatory here. Although I don't believe this thing has the mechanism to battle either the virus or the pneumonia that it causes. So what I started to say is we are actually studying it at NYU. But not only that, we're studying 20 other things. When the president gets up there and says, hey, let's try this, I heard it was good from Dr. Oz or whatever source he's channeling. The fact is there are 20 other things we could try. And so if you look at it from a medical point of view.
I was talking to Dr. J, and he told me, the famous basketball player. He told me, listen, why wouldn't I listen to Dr. J? Yeah, there's a lot of quacks out there that are getting a lot of attention. But the bottom line here is when it comes to leadership, this is not the kind of thing any responsible leader would put out there. And this criticism that those of us who don't like the president are rooting for this drug to fail is also preposterous. No, we'd love to be wrong. We'd love to see a drug be able to be
wrong. Happy to be wrong. It's totally preposterous. It's just an issue of, do you practice medicine according to what some goofball tells you is going to work, or do you organize it, administer the stuff? Look, here's another thing. Do I know whether I should give it 2 times a day, 3 times a day, 10 grams, 15 grams? What if I missed it because I gave it to sick people and they died, but it was only because I didn't give them enough? So if I don't get this thing organized in some kind of systematic way, I don't know what I'm talking about. I don't know what I'm doing. And as I said, we got 20 other drugs that we're looking at nationwide, probably 100. If you don't get some organization here, you're never going to figure out what worked.
But what about the bioethics and the morality of someone who we've tried everything for? We've talked about this, you and I, a lot, and you've obviously written and talked about this a lot. We've tried every drug and nothing's working. And so there are these experimental drugs that we'd like to try. And so how does that apply here?
Well, it applies in 2 ways. When you're dying, absolutely understand. People want to try things.
Rory, the dog, I miss.
Rory, the dog, says yes, she agrees. She's on board here. But if you take dying people, here's a basic question. People have this idea, I take this pill and it gets into my system. Most drugs of the kind we're talking about take 48 hours to get into your system minimum. If you're dying, it won't even activate fast enough to help you. So the first thing you want to know is how quickly is whatever I'm giving absorbed into your body? Because if it takes, some drugs do 5 days to build up a dose, what are we talking about here? So you rule that kind of stuff out. Then you're looking at things like, if it's an experimental drug and I want to try it, again, could I at least say, for the dying person here, I'm going to give him 2 doses at 10 grams a day. And over there, I'm going to try 4 doses at 30 grams a day. Not saying you didn't try it, but you got to organize it. You're still not going to know whether it worked or not.
There's a lot to, I mean, that never even would have considered any of that. Really good points. I was just thinking about how quickly my cannabis drops take effect, and it's not quick enough. Drop them under the tongue. Let's go. Let's get this high. All right.
Right, Nick, if you smoke a cigarette, the nicotine is a fast-acting thing. I get that. But trust me, a lot of these pharmaceutical things we were talking about pumping in, these antiviral drugs, they take a while to kind of get you a dose. By the way, by the time you're trying to rescue somebody, as we've said to, at death's door, you've been on a ventilator more than 12 days, your chances of getting rescued, forget whatever you do, are just about zero because your lungs are shot. So it's not like you're going to take some drug at that point and rebuild your lung tissue, right? It's destroyed.
Yeah, another really good but morbid point. You have a piece at the HastingsCenter.org, which I'll share on the show's show links here. It's titled "The Price of Going Back to Work Too Soon." Dr. Caplan, the bottom line here is we understand why our leaders want us to go back to work. We understand why individuals want to go back to work.
I want to go back to work.
I get it. I understand completely. But What we don't want is to make this thing worse. What we don't want is to be right back where we have been. Is that fair to say?
That's fair. That's fair. So look, I'm going to give you a roadmap about how I think we're going back to work. Some people have already had this disease, no symptoms, survived it. They seem to have immunity. We have to check and see whether they get reinfected. So we'll watch that over the next couple of months. Presuming it's like most other diseases, measles, whatever, once you get it, you get the immunity. Those are the people that are going back first because they're not going to get sick. Then if you had testing, which the president, I think on March 9th or so said, there's a test for everybody, plenty of tests galore. If we actually had the test, which we don't, then you let them out and say they're not going to get sick, and we'll test you every couple of days to make sure you didn't pick it up so you're not infecting anybody else. The roadmap out is testing in the people who survive first. That's how it's going to go. I think people who are really vulnerable, older person with emphysema, chronic obstructive lung disease, I'm probably not letting them, I'm not recommending they go out first. But there is a road to get out. There is.
You didn't mention tracing.
Contact tracing would be useful too. That would help a lot in terms of saying, well, you seem to have come in contact with X, Y, or Z. You know, when we're letting people out, here's the advice. Don't come in contact with X, Y, or Z if they haven't had the disease. So what I'm hoping for is you go back to work and everybody there already is positive for the disease. It just didn't kill them and they survived it. And that's the initial work crew, if you will. You know, that's who's back. And that's a lot of people. I'm going to guess in New York, maybe 50% of the whole population has had this thing. And, you know, while we hear the deaths, there's a zillion people who it didn't do anything to them. They just survived it.
Right. And that's really important to know that those measurements are not being taken or impossible to be taken because a lot of people just aren't symptomatic and so they don't show up. And that's also why this is so dangerous because you pass it to somebody else without even knowing it. You say in this piece, even floating the notion of reopening the economy is grossly immoral. Now, when a bioethicist says something's immoral, you take it very seriously. The president and others have been talking about certain dates, Easter, the end of April. That's not how to look at it. It's backwards, right? You don't set an aspirational goal or date. You follow the data and then decide.
Correct.
Is that right?
Correct. So the first thing you do is you make sure that you're still not on the increase around the country with deaths and new cases getting hospitalized. It doesn't matter what the date is. You want to be on the downslope of that curve. Then why did I think it was grossly immoral? You're trying to get people to isolate. You start yakking about when we're going back, and we're going back by Easter, we're going back by, April Fool's Day, or whatever date you want to set. Then people start to say, well, I guess it's going to be over. So I'm out. Let's go back to the beach, or let's all, have a beer party in the backyard with my buddies. You're trying to get people to do something they hate doing. I don't like it. You don't like it. Staying home, isolated.
Speak for yourself, sir. I'm thoroughly enjoying my family and my garden.
I obviously have the joy of my dog and spouse, but we want to get out. So when you start yammering right away about it's going to be by whatever May Day, you're undermining our commitment or willingness to do it. It's the reason, by the way, they were slow on the mask recommendation. They feared if everybody was told put on a mask, they'd all run out. They said, well, I got a mask, so I'm good. Let's go. That's
a point a lot of people didn't make and didn't understand and still don't. Okay, so can you give us a sense of what's going on inside hospitals right now in terms of the ethical decisions that are being made and how they're being made? We've talked about this a couple times before, and I think in the past when I talked to you, we talked about it as it related to Italy. We knew this was coming. How are these decisions currently being made? Give us a sense of what's happening right now in hospitals.
So here's the deal. We, I think, are getting some benefit from this isolation business. The hot spot for sure is New York City, Long Island, Jersey, North Jersey. Cases are starting to slow on the admission side. That's good because it's not overwhelming the hospital. But there are plenty of sick people. I think we were worried that we might run out of ventilators. We're right on the edge of that, but we're not there. We haven't had to ration anybody as far as I know. That said, the biggest problem right now, the frontline troops are getting exhausted. They've just been going and going, and you can't just take me and say, go run the ICU, because I don't know what I'm doing. Specialized docs, specialized nurses, specialized technicians, that's respiratory therapists, and we only got so many of those. Now, some of them have gotten sick, so they're gone. That means it's even tougher for the workforce. So I'm going to tell you the biggest strain, frontline workers trying to maintain the ventilators, the kidney dialysis, run the ICU, they're burning out because, they're not getting any relief.
Is there any life that is more valuable than another? Can a healthcare worker, a first responder, a physician, a specialist, someone in the ICU, should we value their lives more than mine?
Yeah, probably. Well, yours, yeah. We probably would, only because we want to get them back to work and we're shorthanded. But that definition is that a lot of people will think, well, he's talking about doctors and nurses. I'm talking about first responders. If there's no one to bring you to the hospital, fire department, police, you ain't getting there. So you got to pay attention to them. And if you can't clean the sheets, make food, and clean the room, you need those people too. So we actually have had discussions about, we got to pay attention to healthcare workers, assuming they could survive and they're not too sick. We're not going to waste resources. Anybody's going to die for sure. But it's a tiebreaker. Makes sense to me, but does it make sense? It's a broad definition. You're not just saying, oh, it's a doctor or nurse. We'll pay attention to them. Nobody comes to clean your room. The hospital falls apart. So you got to put them in the same boat, and you got to have the police and the cops, ambulance people there too.
All right, final question for you. I guess this is kind of not bioethics, but maybe it is. The idea that I suppose we didn't think that our political leaders would ever give press conferences where they'd be irresponsible, they would be speculative and give out misinformation or even disinformation. I guess we didn't ever think we would be there. And when you watch these governors, they're generally, I've been not giving them a lot of credit, Dr. Caplan, because I don't think it's that hard. You listen to the experts and you try to wrap it up with some kind of inspiring message where we all come together. It's not that hard. What is your thought process? What are your thoughts on the fact that the cable networks or any other media outlet would cover these press conferences with the President of the United States that are where he is delivering so much disinformation, misinformation, attacking reporters for asking simple and obvious questions? What do you think the media should be doing in terms of reporting on the president's comments in those press conferences or anywhere else?
Yeah, well, look, President got us into this. White House gutted their deep state. Who's the deep state? FDA, CDC, NIH. That's who it is. State Department, if you're going to block travel, et cetera. They came in to kill it, and they did kill it. I blame them. So we'll get to that in the political campaign, I hope, about finger pointing, and I know where my fingers are pointed, and it's not back to the Obama administration of 4 years ago. It's what these guys did when they showed up. President doesn't have a clue about science, babbles on about whether his favorite cure or whatever strikes his fancy at the moment, or why he doesn't like, what's that show, Tiger, whatever it is.
Yeah, that was an insane question that he was even asked. But he talked about having sex with models while talking about modeling the deaths. I mean, that was the lowest point as far as I remember. It's absolutely horrific.
So as the job may be easy, he's failing. The governors are doing better. If I'm the Democrats, I look at Joe Biden and I think, he's not leading anything right now with respect to this pandemic. The issue will only be the pandemic. Who's to blame? Who flubbed it? Where are the masks? Why are you lying to us about protective gear? That's what I have to go after. I'd rather see some of these governors run. Again, I'm not saying they're geniuses or, you can take your pick among Cuomo, what's her name in Michigan?
Gretchen Whitmer. Yeah.
Whitmer, Newsom. I don't really care. At least they've been in charge.
Well, I say, because I understand politics pretty well, and I say Gretchen Whitmer is beautiful and Gavin Newsom is beautiful. So put these two beauties on a ticket. I'll put her.
And what are they, 25 years, 30 years, 40 years younger than Mr. Trump? All of a sudden, the age thing looks a little different than
Trump
if you're running
and
Biden
Biden
against Trump.
Yeah.
Anyway, we'll see. But I think the governors, I'll give them, a C. And I would give Trump an F, but since this is going to be the campaign, I'm kind of leaning that way.
I understand. I don't know how that could ever possibly happen at this point, given the process that we've already gone through, but I'd love to see something change. All right, Dr. Arthur Caplan, always appreciate your time here on the podcast. And so do listeners. I got to say, every time you come on, people write me emails and tweets thanking me for having you. Thank you as always, pal. Appreciate it.
Thanks.
That is Dr. Arthur Caplan of NYU Langone School of Medicine. He's also on Twitter at Arthur Caplan. Read everything he writes. Always good of him to join me. Always a thoughtful conversation where I learn a lot from him. And I've learned a lot from my friend Prakash Gatta. I'm just so excited that he is okay. He was diagnosed. He's a surgeon out in Tacoma, Washington. He was diagnosed with COVID-19 weeks ago. He reached out to me and let me know what was going on. And my relationship with him has always been, he was a listener to my show, and he would call into the show. For years and years he would call the show. He's always a great caller, always thoughtful conversations that we would have on the SiriusXM show. And we've kept in touch, of course. And he joined me after he was basically recovered from COVID-19 and going back to work. And he had made these videos. And I'm sure the MSNBC producers heard him on the show or saw him videos I put out of my first interview with him and invited him on after he'd made these dispatches as well from his hospital. And Rachel Maddow then had him on her show last week, and I am beside myself with excitement that she had Prakash on, Dr. Prakash Gatta, on the Rachel Maddow show. She played some of the clips and then goes into the intro, and that's where I will pick up. And you'll hear this intro, and you'll hear a little bit of background noise because listening to this intro is Prakash at his home in Washington State, and you'll hear the kids in the background a little bit as we're listening to Rachel Maddow introduce him and one of his dispatches from the hospital. Gives me chills just listening to him talk about the heroic work that he and other physicians are doing. And, well, here it is, my conversation with Prakash Gatta. We'll let Rachel Maddow kick it off.
Proud to work here. That dispatch from the front lines came to us from Dr. Prakash Gatta, who is a surgeon at Multicare Tacoma General Hospital in Washington State. We played that clip from him on the show last night, and it hit a nerve. We got a big reaction about the footage that we showed of Dr. Gatta. Dr. Gatta is an esophageal surgeon, which is not only something I can't do, it's something I can barely say, and I've been practicing all day. He's an esophageal surgeon. Maybe, I think that's the way you say it. He specializes in robotic surgery, which is impressive just on the face of it. But consider, too, how he got to this point. As a child, Dr. Gatta and his parents and brother were refugees. They fled Kuwait during the Iraqi invasion. They later emigrated to the U.S., whereupon he literally grew up to become an esophageal robotic surgeon. Now, with that remarkable life arc, he can also say that he personally survived becoming infected with COVID-19. He got sick, he recovered, and as soon as he was recovered and cleared to get back to work, he went right back to the hospital, right back to the front lines.
Here I am back to work after COVID-19. And for my patients out there, for the people with fear, know that no matter what happens, we never work from home. The lights are always on. Babies are being born, bones are being set. This hospital, this profession, we're in a league of our own. We'll take care of you. I promise.
Joining us now is Dr. Prakash Gatta. He's a surgeon at Multicare Tacoma General Hospital in Washington State. Dr. Gatta, I know you're working more.
All right, that's enough from Rachel Maddow. He's my friend. My friend. Hey, pal.
Hey, Pete. How's it going, brother?
Thank you very much for joining me again. That was a pretty big deal. Rachel Maddow, what was that, last Thursday night?
Yeah. Why? Did something happen on Rachel Maddow show?
So great, man. I'm so happy that happened, and I want to talk to you a little bit about your appearance on Rachel Maddow before we get into medicine and everything that's happening again. But first of all, how are you feeling now in terms of your own health? You were telling me just before I pressed record that you've been not feeling great today.
Yeah, it's a little strange that people keep saying no one's ever. It feels like this is a flu you've never had before. You never felt so sick.
Who's that? What child is that?
Hey, come here, buddy. Come here. This is my little guy. This is my son, and he fell and bumped his face on the sidewalk because he was trying to show off to the girls yesterday. But
nice.
You're okay, right?
The amount of injuries that I've had for trying to show off for girls is long.
What do you want?
And embarrassing.
Huh?
Can I let go around?
No, let him here. Leave him here. Sorry, brother. Sorry about that. Anyway, so the
your health, the symptoms.
Yeah. So today, for some reason, I felt a little more tired and a little more chest pain, which is weird. And it wasn't because I was smoking my weed or anything, because I don't smoke weed, just FYI. So it just felt like just worse and more tired today, which is really strange. Generally, when you overcome the standard influenza virus, one of the adenoviruses, you get when you get better, you're better for usually the rest of the season. This somehow seems to have a way of reminding you that it's still in your system. I hope that means that I'm not still shedding the virus, and I doubt that would be the case. But there is still so little we know about the virus. So I'm following all Department of Health guidelines in terms of return to work and personal protective equipment use, etc. But the point is that you never know how long it would take to completely recover. There's still some fatigue and weight loss, which I'm hopefully starting to regain. But overall, a lot better than when the sickest I was.
When you say I might still be shedding the virus, you mean I might still be contagious?
There's a possibility that you may be contagious. It's also a possibility that when they do the PCR test, which is the nose swab, they may be detecting virus that's shedding a very low level, which means you may not be contagious as much as you were when you were coughing or sneezing. But it is always better, obviously, given the risks, to just be safe, which is what we're all practicing as a family: social distancing and wearing masks when you go to the grocery store, at work, etc. Following all the requirements that we've been asked to do.
So you've been we heard in these videos that you've been making, and as you talked about it on the Rachel Maddow show, you really are comparing this to combat, to war. And I think that's a very appropriate comparison, except for the difference with combat is if an American goes to, a theater of war from World War II to Vietnam to Iraq and Afghanistan, they don't bring the bullets home with them. They bring home the psychological effects and so on. But in this case, you're going into battle potentially contracting the virus and then potentially bringing it home to the people that you care about the most, which makes this so much more of an apt comparison. Talk to me about that combat war parallel that you've been making.
That's a very you're right, because when you go to war, you're deployed somewhere, you kind of are there until you're done with your deployment or the battle of the war, etc. It is true that at some point when we go to work and all the healthcare providers, particularly the frontline providers, they do go home. They hope to be able to go home as much as possible. I know a lot of my colleagues aren't going home. They're staying in a hotel or an Airbnb just so that they're writing this out. Some of my friends will take the clothes that they wear to work off in the garage, go straight to the basement or another bedroom or another part of the house, and not try to wall off part of the house where they use so that they don't try to contaminate their family. Stuff that we're not really trained to do or conditioned to do in our mind. The reason the war comparison makes sense to me is, first of all, I've never had the honor of serving in the military. And if I did, I think this is the closest I would ever have that, the ability to do. So try to do something selfless, take risk to protect others, right? So that's essentially the essence of service, particularly military service, is that where you're taking risk so that other people don't have to, particularly your loved ones. So this is the closest to the healthcare providers that haven't served in the military, like me, will come to that. It is not obviously not the same as, Okinawa or Iwo Jima or those statistics, those historical battles. But the very fact that even if it's a small percentage of physicians or nurses or PAs that have to face this fear, they do. The great part about this is the courage demonstrated by my coworkers, so these guys come to work with fear, but they're doing their duty, and that's what makes me proud to do what I'm doing, because I'm walking with these very courageous souls that do it with disregard for their own safety.
So you're a surgeon, as Rachel Maddow said, esophageal, although it was so difficult for her to say that word for some reason. Anyway, normally you do elective surgeries, so you've been diagnosed and have, quote, recovered for the most part from the COVID-19. So what are you doing when you go to the hospital? What is your shift like? How many hours, how many days, and what is your work, if not what you normally do?
So the number of elective surgeries, we're not doing things that can wait. That's the bottom line. But we do have patients that have cancer operations. We don't want them to wait. There's patients that have emergency surgeries. We still staff the emergency room. So if you're on call for an emergency on a day, and if a patient comes in with an emergency that needs an operation, we're still fully functional and able to do that. So there's the volume of cases has gone down significantly. For me, probably down by 80% or 85%. We're still seeing patients, and by that I mean physically going into the office, clinic patients, and doing virtual visits like through cameras, etc. And that's for many reasons. We're trying to reduce the number of people, particularly my older patients that have to leave the house. And we're trying to do virtual visits, where the physical exam, actually having touched the patient, is not as relevant in terms of developing a plan for a surgery or not. We're trying to do that over the computer. So we still go in, trying to provide service in the office, trying to do non-elective operations emergently. And the other thing is, if and when the ER gets overwhelmed, or if the number of ER providers start getting sicker and not being able to function, if we have staffing issues, we would back up the ER, we would back up the ICU for patients on ventilators, etc. And I'm happy and thankful to say is that although our hospital system has been prepared to do that for several weeks now, we haven't quite got there. It could change tomorrow, so I don't want to jinx anything. But we have not, thankfully, had the logarithmic and exponential growth of patients as, the downtown New York City hospitals or Brooklyn or Bronx have had. So we have to thank the social distancing and the early adoption of this a few weeks ago that has allowed us to maintain capacity and match it with patient flow.
I think one of the difficult things for experts like yourself to convince people of is proving a negative, proving that the reason why the virus hasn't spread is because of the precautions we're taking in terms of social distancing. Is there any way to ever convince people that this is why it's working, this is why we need to keep doing it, and God forbid, potentially have to do it again if it comes back?
That's an excellent point. And the reason the numbers have gone down or not gone up is there's almost that exact 2 to 2.5 week delay between. So let's say New York City didn't do any social distancing until today, and the rate of new infections and deaths are going up. It is only 2 weeks to 2.5 weeks into that initiation of social distancing that we're starting to see a plateauing or a dropping in the numbers. So there's no question that the science is sound, that social distancing works. And you're completely correct that people don't want to look or think or sort of imagine that I'm doing something today for the society and 2 weeks from now it's going to help. So the very fact that such a high or significant percentage of Americans have followed those distancing guidelines is because what I would consider the sort of the citizenship of our society, the patriotism, and the fact that people are coming together and telling people who are not socially distancing to do so, and sort of educating as the information is disseminated on programs like yours, or the news programs, or the press conferences that the White House is having, and by that I mean that the sort of scientists speaking at that press conference, presenting data, charts, and graphs, that hits home to me. I can understand it. They present it in a way that the general public can understand. And I think the message is getting across to the vast majority of countries. So another example is, suppose at a federal level, someone says, hey, let's just skip social distancing, let's get back to work. I think a lot of states, governors, no matter what party they're at, understand their responsibility, and the state and local authorities would also probably not follow along with that. That's what I predict. And I think the public would probably not do that. So I think there's enough awareness now. There is always going to be complacency. So as we see numbers starting to plateau, I think it's very important to disseminate the message that we're doing, like you're doing now, to sort of keep pushing to say, this is a hard fought. We've won the battle. We haven't won the war. Things could change rapidly if we change some things. The other way we can potentially reopen the economy, which I know is very important for all of us, is when antibody testing eventually becomes ubiquitous and everyone has the ability to get tested. That would sort of really, in a scientific way, tell us, hey, let's return the people with antibodies, in other words, with immunity because they got infected, to go back to work because their chance of spreading that virus is a lot lower. They have immunity, they can't get sick, and therefore their viral loads and infection rates won't go up, and therefore they can't infect other people. That's the only scientific way of allowing people to return to work. So I think we're obviously lagged behind a lot in terms of testing and now antibody testing. We're behind a lot of people. We shouldn't have been. There's no question lives have been lost because of that. I think that was there's no way to disprove that. But that's the solution, is testing, science, antibodies, maintaining social distancing, all of which is based on science. This is a victory of science over disinformation. That's what I like to, that's the way I want to.
Yeah, unfortunately, we're still partisan in terms of the way that we get our information, it would seem, which is absolutely crazy to me. But you're also saying, before I pressed record, that there's just so much that we still don't know about this disease. And we're still at the beginning stages of trying to understand it. You said that there's some data that it might have already mutated a couple of times, whatever that means. I hadn't heard that. Talk to me about, is it true that there's more that we don't know than we do know, Prakash?
So the most information we have as to how we believe this virus is going to behave probably comes from a different virus, the SARS-1 virus from 20 years ago, or from the way we believe RNA viruses in general propagate. So sort of the air, is it a droplet-based virus? Is it an airborne virus? Those are two different things. So we know how some diseases spread. There's new data suggesting that there's a fecal-oral route, which means you can sort of consume virus into food, not breathe it in, and then get infected. There's that theory. There's theories that it can. The way I likened it is, you're literally writing the book chapter. There is no chapter to refer to for the novel coronavirus, the COVID-19 virus, the SARS-2 virus, whatever you call it, is writing its book chapter, and it's hiding certain aspects of it, and that's coming out of left field. So if you're an intensivist running a ventilator on a patient that's really sick, tomorrow the virus is doing something that you wouldn't have predicted. I'll give you another objective statistic. In the initial stages of the virus spreading in Italy, the highest percentage of physicians that got infected and died were cardiologists. And why? Because a lot of patients with coronavirus are coming in with chest pain and myocarditis or conduction delay or cardiomyopathy. That's not something the virus is supposed to, a respiratory virus is not supposed to do that. So a patient comes in with chest pain who's 40 years old, you're not going to think he's coming in, he's not going to have a heart attack because of this virus. So you send in the cardiologist without PPE, without a mask and a gown, because this is a cardiac patient, right? No, it's not. So there is there's a significant percentage of patients that are coming with that. They're also seeing there's a certain percentage of patients coming with GI symptoms. Half of them have some kind of abdominal cramping or diarrhea. Some of them have an elevation in their liver enzymes. A large percentage of patients are seeing an elevation in creatinine, which is essentially the sign of renal function. So they're coming in with renal issues, kidney function delay or problems. A lot of these are correlated with worse outcomes. So a month ago, we wouldn't have known to look for that. So a patient comes in with what we think is coronavirus. We're not necessarily looking at their cardiac function. And by understanding what has been done a month ago in a country half a planet away, China, South Korea, we are trying to manage disease and treatment here in the U.S. So again, we talk about the victory of science over disinformation. This could be a Chinese doctor or scientist or researcher that is publishing or trying to disseminate information based on how they're treating their patients a month ago, trying to get this information out of the news blockade that the Chinese government may have. I don't mean to single out one country, but I'm just saying there are people, the real heroes out there, like the first doctor who warned about this virus, who died in Wuhan. He was a Chinese doctor, young guy. I don't remember his name, but the point is, these are the true heroes. They understood that this was a crisis. It was a health emergency, and it was their selflessness to transmit this information to warn my colleagues here that, hey, look, this is something. We've gotten beat up by it. This is what worked. This is what didn't work. We're going to try and publish it. Please, try and get it peer reviewed, and trying to spread the information to their colleagues across the world. That's never happened before, because, everyone in their own countries, it's just the way the society is. You want to get published and you want to present all over the world, but it's never reached the level where if you don't publish and you take a week or 3 more days to submit your data, that would translate into lives. So, when people say mathematics and physics is the language of the universe, this is the language of medicine. These physicians are speaking the same language no matter what language they speak at home. They're using science to try and save lives, and no one has ever seen anything like that.
That's awesome. That effort's being made internationally. I bet a week ago or 2 weeks ago, you never thought that you would be on MSNBC's The Rachel Maddow Show. Tell me what that was like. How did that come about?
So I will tell you that, and I'm thankful that Pete, you're a friend of mine, and I used to call into your show all the time, and for the coaching you gave me before that happened, because I have never been more frightened in my life.
Which is hilarious, because you're a surgeon.
I'd be more comfortable helping someone or opening someone's chest or belly up. That scares me so much less than to be called a couple hours before the show to say, hey, we're coming on. And then another piece of the story is that they wanted me to go up to one of the news channels close by, one of the affiliates, and based on their own healthcare protocols, in the last minute they cancel on me. They essentially said, you can't come into our studio because you've had coronavirus, and it just didn't work for them. So that was a last minute thing. I don't want to throw anybody under the bus, but we had to sort of scramble to download software on my work computer, which has its own restrictions. And I have to thank my IT staff and my hospital system to let me do that. And then doing sort of the sound check. And so in the lead up to those few minutes, the pure fright that I ever had, if I had a bottle of scotch in my office, I would have drank the whole thing. And I don't have a bottle of scotch, just for the record. This is going to my employers. The point is that the fact that out of every host on TV, the only person I watch is Rachel Maddow. she's the person I admired most. I've watched her for 10 years since she's been on TV. She had a radio show before that. I have watched and followed her history because I love her to death. All my friends do too. The way she weaves the story in and out and sort of the first 20, 30 minutes of her show is just incredible. So I've been an incredible admirer of her. And to watch that split screen as you're doing the live TV of me on camera next to her asking me live questions is the most surreal experience I've ever had. And I'm just, I'm glad it was over after it was over, but nothing could have prepared me for that sort of that.
Well, you rose to the occasion, my friend. You really knocked it out of the park. It was an excellent appearance on Rachel Maddow. Everybody should go back and watch it. It was last Thursday's episode?
Yeah, that was last Thursday. Yeah, it was minute 26.
So you were on for minute 26, is that what you said?
No, it was on the 26th minute of the show is when my part started, which was like segment B, I think, whole segment B.
What did your colleagues and your family and friends think of you being on that show?
No, I think nobody believes me, because nobody believed that it's a sort of a lot of shock and surprise. And a lot of people didn't know I had the virus. I wasn't going about and telling people. I didn't want to alarm anyone. So a lot of people reached out to me out of concern. There's been sort of an incredible response across social media, people reaching out to me, so incredibly touched, giving me their own stories. They thought that my segment they mentioned that they were brought to tears by what they thought was authentic feeling. And, it's an overwhelming and very, very humbling response to that segment. And I didn't think it would have that kind of effect. Sort of for me, it's sort of a life-changing, I don't know about life-changing, but at least a seminal event in my life to be able to be up and be able to relay my story. My goal was to present the voices of all of my colleagues. Not everyone gets a chance to speak on national TV, so I wanted to take their voices and do the best I could in that short period of time to present to them what I think they would want to say, and I hope I was able to do that.
You were. You nailed it. And I was one of those people crying, and partly because I was moved by your words and your honesty and your authenticity, and partly because I've been talking to you for years and years, and to see your face on TV was remarkable and cool, and I was really proud of you, man. Really proud of you.
I have to. Your friendship has meant a lot to me, and thanks for coaching me. And who would have thought I was so handsome on TV? I mean, thank you for.
I would have thought you would have fixed your hair a little bit more.
My wife cut my hair, brother. So Sarisha, she's a great hair cutter, So thankfully, she made me look a lot less crazy than I would have looked like a mad professor if she didn't cut my hair the day before.
Thank you for talking to me again. We'll touch base again soon on the record and obviously off the record plenty. I appreciate it, pal. I'm glad you're feeling better and keep up the great work. All right, there it is. Prakash Gatta. By the way, if you want to follow him on Twitter, he is on Twitter at Gatta Surgeon, Gatta Surgeon. I was just so excited to see him get that attention and that everybody got to hear what he has gone through, and just so brave and inspiring. I love that guy. We're really good friends, and I'm really excited that I can help amplify his voice yet again. That's all I've got for you today on the Monday broadcast. Thank you, Dad. Thank you, Dr. Arthur Caplan, and thank you, Prakash Gatta. But the biggest thanks goes to you for listening to today's show, especially if you are a paid subscriber. Thank you very much. That's how I do it. Can't do this show, certainly not daily, without your paid subscription. So if you haven't signed up yet, please do go to the show notes on this podcast where there is a link, or just go to PeteDominic.com. You can link to it there, or Patreon.com/PeteDominic. For as little as $5 a month, you can sign up. Get all these great guests each and every day. I mean, you get it anyway, but there's no way I can do it without your support. This is independent media. There's a lot of good independent media out there, and I appreciate you supporting mine. We'll talk to you tomorrow right here on Stand Up.